Good day everyone, this is Edel Hydie Manalo from BSN 3F. For today's video is about providing tracheostomy care. For the goal, the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For the equipment, bedside table, towel, 2 sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, sterile basin, small sterile brush, pulse oximeter, stethoscope, clean gloves, mask, goggles or face shield, hydrogen peroxide, and plain NSS or sterile water. For implementation, bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Next is to identify the patient. Close curtains around bed and close the door to the room if possible. Determine the need for tracheostomy care. Explain what you are going to do and the reason to the patient even if the patient does not appear to be alert. Adjust bed to comfortable working position, usually elbow height of the caregiver, lower side rail closest to you. Next is to check for the lung sounds. Place the towel below the trachea site, covering the neck and chest of the client. Prepare the basins and cleaning solutions. Mix sterile water or plain NSS and H2O2 in one basin in 50-50. Be sure it will fill 0.5 each of the basin, and another plain NSS in another basin that will fill at least half inch. And next is to perform gloving. Gently remove the inner cannula and place it in the burst basin with plain NSS plus H2O2. Let it submerge there for a few minutes. Gently slide the trachea pad or dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, or inflammation. Clean the inner cannula of the trachea tube using the prepared plain NSS with H2O2 and use brush to remove solidified or sticky mucus. Next is to rinse the inner cannula using the second basin with plain NSS only. Dry the inner cannula using sterile gauze pad. And then next, gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under paste plate. Use each applicator or sponge only once, moving from stoma side outward. Pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing and check the fit of tracheostomy collar. Remove gloves and remove additional PPE if used. Perform hand hygiene. Reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.